Hello, good evening. Dr. Chudi Ufondu of Snowspirations Global Health Solutions. How are you? I hope you had a wonderful evening. I hope you had a wonderful day. Today, we're going to look at ovulation tracking. If you have irregular bleeding, how can you track your ovulation if your bleeding is irregular? Remember, if you want to become pregnant, there are certain things you need to start doing. There are certain knowledge you need to acquire so that you can become proficient in helping yourself to achieve pregnancy naturally. So when you join today's clinic, I want you to introduce yourself. My name is Dr. Chudi Ufondu. I'm the convener of this group. And this evening, I'm going to help you to understand what you can do differently regarding tracking your ovulation and also, hold on, let me increase the volume. Okay. Also, giving yourself a better chance of becoming pregnant. If you can hear me clearly, just give me a thumbs up so that I will make sure that everybody's on the same page. So join, I'm gonna use my good friend to help us to understand what we need to know regarding ovulation. So please quickly make yourself comfortable, announce your name, announce your location, and I'm gonna start as soon as I have a good number in the clinic. We're talking about ovulation in women that have irregular bleeding, irregular cycle. Okay, I'm gonna start. Now, many mothers to be actually ask, how can I track my ovulation if I have irregular period? So irregular period means your period is just erratic. So you can't really chart to know if it's every 21 days, to know if it's every 28 days, to know if it's every 35 days. It's all over the place. Some months is 21 days, some months is 40 days, some months it's 60 days. It's all over the place. When you find yourself in that situation, it's very difficult to apply the constant 14 formula. But when you have a regular predictive cycle, so regular predictive cycle means you bleed every 21 days, sure. You bleed every 25 days, you bleed every 28 days, you bleed every 35 days. If that's your pattern and you know you have it constantly, we can pinpoint to some level of accuracy your ovulation. However, when it becomes irregular, it's tough to know exactly when you can by yourself. But I'm going to help you this evening to walk you through on what you need to do. You just need to pay more attention. Now, for us to track your trends, I want you to be conversant with your regularity just on monthly basis. So if you can go get a plain paper, let's start from January to see your pattern. So when you get your plain paper, go to your January, when you get your plain paper, number from January to June, the month. Then if you go to your January, please put the first day you bled in January, your real bleeding. Don't put spotting. Spotting is not part of what we use in calculating ovulation and fertility window. Real bleeding. So when you put the first day you bled in January, put the last day you bled in January. If you spotted for 2 days, then you bled for 4 days, and you spotted another 1 day, your bleeding is 4 days, not 6 days. When you get to February, do the same. When you get to March, do the same. When you get to April, do the same. When you get to May, do the same. If you've already bled in June, do the same. Now, when we find these numbers, count the number of days between each month. When you count the number of the days between each month, if you are able to get 21 days, that's normal. That is on the lower limit of normal. If you were able to get up to 35 days, that's also normal. It's on the upper limit of normal. The commoner one is around 28 days. So if you have 28-day cycle, predictable, regular cycle, your ovulation will be on day 14. if you start counting from the first day you bled. If you have 30 days, your ovulation will be on day 16. So it's a constant of 14. If it's regular, we are talking about regularity. So it's not applicable to everybody. You have to have a regular cycle so you can predict the ovulation with some level of precision. Now, thank God, for women that have a irregular period, there are a couple of things we can do with help to help you to figure it out. You have to chart your cycle. So when you chart the cycle from January, just like I told you, it will give you an eye there to notice some clues, to notice some pattern, to notice some changes, so that when you eventually come to your provider, who is your gynecologist, we can use that to see what we can do for you. There are some women we can give ovulation induction drugs. There are some women we can give some hormonal drugs to achieve what we call breakthrough bleeding. But we have to know your pattern before we proceed. So the first thing I want you to do is to be conversant with charting your cycle. Number 2 is very important. What I'm going to say now, it's very, very important. If you are friendly to your body, if you are very much aware about your whole reproductive system, if you know the role of the vagina, the cervix, the womb, the tubes, and the ovaries, then you will know about cervical mucus. Cervical mucus changes can tell us when you will likely ovulate if you have a irregular cycle. If you're not friendly to your body, you will not know about cervical mucus. If you don't pay attention, you will not know about cervical mucus. But if you pay attention, when you are not bleeding, pay attention to the consistency of the fluid that comes out from the cervix. The cervix is at the junction between the vagina and the womb. So if you're accustomed to knowing the changes that happen in the cervix, shortly after your bleeding, your cervical mucus will be near dry. Now, as you're getting ready to enter another period of ovulation, the mucus will start increasing in quantity and in feel. As you approach your ovulation, there will be a lot. So you will produce a lot of mucus from the vagina through the cervix. Now that mucus will be slippery, clear, and stretchy. If you put it between your 2 fingers, you will see it like pap. That's an indication you might have likely ovulated. In majority of women, before they fully ovulate, they will notice an increase in the quantity and the consistency of your cervical mucus. Most people will say that it's egg white. This is very important. So pay attention to your body. For you to get to your cervix, you have to insert a clean finger through your vagina and advance a little bit further. So when you insert this is the vagina, when you insert your finger and you advance further, you get to the cervix. You can feel the fluid. You put it between your thumb and the first finger, then you can feel the consistency. It works. Number 3 method, basal body temperature. If you pay attention to your body, especially very early in the morning, there are some months exactly at the middle of your cycle, you will notice a little spike in your body temperature, as if you have fever. This is significant to so many women because as your body is getting ready to enter ovulation, you will notice some fluctuation in your temperature. You will start having a little spike in your temperature. As an evidence, you are ovulating. So if you can pinpoint your ovulation based on the regularity of your cycle, employ the 3 approaches I gave you. Make sure you chart your bleeding. Make sure you chart any changes. Keep an eye on your cervical mucus. It's not all women that will have cervical mucus. Some will have it, some will not have it. But I'm giving you some clues you can use to improve your chances of knowing when you ovulate. I'm teaching this purely for academic purposes because in our group, we don't time our love making. So think about charting your cycle. Think about the cervical mucus. Think about the basal body temperature. It works. Now, we are in 2023. Thank God there are some advancements. There are some technologies that can help you to track your ovulation. It's called Ovulation Predictor Kit, OPK. Now, you can buy it in any pharmacy. Just go to the over-the-counter section. You tell them, they will give you the testing kit. So what do we test? When we're using ovulation test kit, we are simply checking for the level of LH, luteinizing hormone. Luteinizing hormone is a very important hormone that is consistently seen in the urine. But when you are about to ovulate, within 24 to 48 hours of ovulation, we will notice a spike in your LH level. So if you can't pinpoint exactly, but you know you still have X and you know you're still ovulating, go and buy your ovulation test kit. Once you begin to see a rise in the level of our LH, engage more. Remember, you're supposed to be making love every other day, but engage more about that time. 24 to 48 hours. When you notice a rise in your LH, when you make love, possibility pregnancy will happen is very high. Remember, the first day of your bleeding is the first day of your cycle. Very important. If you can pinpoint all this, then by the special grace of God, you can study your body. You will know exactly when to participate. And by the special grace of God, you will become pregnant. Remember, this calculation is applicable to women that have irregular cycle. Some women can have irregularly regular cycle, and some women can have regularly irregular cycle. How do we know? We track your own cycle. You chart your own cycle. So if you have not been charting in January, start this June. Mark the first day you bled in June. Mark the last day you bled in June. When you get to July, mark the first day you will bleed in July. Mark the last day you will bleed in July. When you get to August, repeat the same thing. By the time you get to December, you will see a pattern. That pattern will help you to become pregnant. So that's my presentation this evening. I'm going to give you an opportunity to ask your questions. So please start asking your questions. If you have any questions, feel free and ask. Okay? If you have any questions about this female reproductive system, feel free. This is my very good friend. It's helped us a lot since 2015. So ask your questions. I'll provide you feedbacks. Okay? If you wouldn't mind, share your own cycle with me. What's your cycle? Is your cycle 21? Is your cycle 25? Is your cycle 35? Is your cycle 50? Once your cycle is above 35, we are worried, especially if you want to have a baby. Remember, the reason why we're talking about all these for people that want to have their babies. Now, if you have a cycle in the neighborhood of below 26 down, they are called short cycle. If your cycle is on the neighborhood of above 30, they are called long cycle. We always have to adjust the scale to accommodate both the long and short cycle. So the knowledge of your cycle is very important in avoiding pregnancy and also becoming pregnant. There is a concept of the so-called fertility window, which is the best time to become pregnant. Understanding that the sperm will last for 5 days and the egg will last for 24 hours. When you add the lifespan of the sperm and the egg, you will get your fertility window. That's a total of 7 days. You have the best chance of becoming pregnant. All right, guys, if you don't have any question, then we're going to transition to Facebook. I'll repeat this same topic in Facebook. Then afterwards, you can ask your questions. Remember to share this video. Remember to share with your friends. Set your notifications. I normally come forth in YouTube on Tuesdays and Saturdays. But pretty much every day in Facebook is a day of learning. So join me in Facebook in a few minutes and we continue the conversation. Until I see you, thank you and bye-bye for now.